WHIS is a platform. We're all familiar with platforms. We use Google, we use Facebook, we use Twitter. These are digital platforms. So when I say a platform, you automatically think, oh, that's a digital platform. This is far better than a digital platform. This is meaningful interaction as a community on a social interaction level. So it benefits everyone. This platform is for 7 billion people. It has a great opportunity to bring people together, to tackle social isolation at the same time as we grow our economies for sustainability and regenerate communities, from children in the schools with kids to our senior citizens with seniors. We all work together collectively. That's the beauty of this program and this project. It's there for everyone. We've brought it from a tweet to now on the international stage. You know, we've spoken at Davos. We're supporting the Sustainable Development Goals, their implementation in 25 cities worldwide. It'll impact over 100 million people. This is just the start. Where we see ourselves in the future is growing and evolving and supporting communities worldwide in your local community, making a difference on that circular economy model, generating income streams, but then reinvesting it back into the community. But the ownership is with the local community, so it stays local.
Good evening, good morning. Welcome to another of our WHIS Talks. Today it is my great pleasure to introduce wonderful women whom I highly respect for the work they've been doing in regards to children's health and well-being. I have the great pleasure to introduce you all Dr. Rosie Nash, PhD, University of Tasmania. She's a lecturer in public health and health systems. She's the co-founder of a fantastic program called Health for Kids. We also have Dr. Shandell Elmer. She's a senior research fellow at the University of Tasmania. She's working within the Center for Global Health and Equity with a focus on health literacy research relating to the prevention and management of non-communicable diseases. And also Mitra Zayam. She's SAMS, so Swiss Alternative Medicine Children's Educational Trainer and WHIS Kids Certified Trainer. Now, Dr. Rosie and Dr. Shandell are here participating from Australia, from Tasmania and from Melbourne. And Mitra is joining us from Geneva. So thank you for all of you for participating, for being here today and tonight. Like I said, I'm so very pleased to have you all. This is basically becomes a little bit at the end of Health Literacy Month. We're just one day outside the month of October, but what a wonderful way of completing this amazing month with so many people participating, but ending with children. Children are absolutely our future, and it's just such a nice note to really conclude Health Literacy Month talking about children. So I'd like to start with Rosie, and I'd like to ask you, and I can just, first of all, please do introduce yourself again. I'm sure you have done so much more compared to what I just mentioned. So perhaps if you'd like to introduce yourself, and then also tell us a bit more, why focus on children's health and well-being? Why is that important to you?
Okay, so I guess the best way to describe my background is, and the reason why Health Lit for Kids came about was I was a pharmacist in community and also hospital pharmacy for quite some time, dealing with patients at the sort of latter end of their life. And a lot of patients I was counselling about medication and encouraging to have lifestyle changes following their most of them were having bypass surgery when I was working in London, in Hobart and also in Melbourne. And then I noticed this pattern and I thought, wow, we've got a real opportunity here to do something sooner. And I'm also a mother, so I've got children at home that I speak to in a language that I'm guessing a lot of children don't get at home. And so I thought spoke to Shandell one day, and we talked about this concept of bringing health literacy into the classroom and for more children, so that we can make sure that there's access for all children, not just on those who might have parents at home who speak in a way that I was.
Right, that's wonderful. Right, and so do you, Shandell, do you share the same work? Have you been working with Rosie also in the same program for health for kids, health literacy for kids?
Yeah, Rosie and I did have a really interesting discussion, I guess, where Rosie's clinical background, professional background is pharmacy, mine is nursing. So we both come from a health background. My interest in health literacy is from a slightly different perspective, though. One of my passions is around community participation. So it's always about how the community have a voice and are able to participate in healthcare. And I think often for children, they're the receivers of health messages. But what I think is really important is that children are able to make sense of health and wellbeing and create health messages in ways that make sense to them, so that they become the creators of the health messages, not just the receivers of health messages. So it's really about how we can support them to participate.
Yeah, fantastic. Absolutely. What a great point. And Mitra, welcome. Please tell us a little bit more. I guess your program with kids, to me, it kind of resonates a lot with what Rosie and Shandell have been talking about, including and really participating, engaging children and helping them fostering health literacy for well-being. What's your view? Mitra?
Actually, I'm a certified educator for WHIS Kids program in Geneva, Switzerland, by SAM, Swiss Alternative Medicine. And I've been working with children for years, and the passions I have for children and the high understanding I have them, that makes me works better for them. And I'm very happy that I'm working on children's health literacy, because I think it's very important, especially these days, and I'm very happy that I'm doing this. So
yeah, fantastic. Okay,
should continue for explaining more, or
right? Oh, okay. Thank you, Mitra. We have just a little delay.
Okay, so shall I continue just saying how important is this for me, especially?
Please, please.
Because these days, that all the psychologists these days, refers many of our problems to our childhood, these days, because it's really important. I think that health literacy and, children's health is an integral part of their social, psychological, emotional, spiritual well-being. And it's really important. Prevention has been always the key strategy to reduce the incidence of many diseases, mental and psychological and physical. And education has important role in this strategy to reduce the incidences, And if this education starts at childhood, that would most probably be more effective. And the education that children will understand how their health has an impact to their decisions in life, and how their decisions has an impact to their health and education, and how all this has an impact to their self-confidence and self-esteem. And it's all for getting the better and best decision suits for them in order to navigate their lives towards their goals.
Right. Okay. Well, thank you. That's really very interesting, very powerful. And Rosie, I wonder, of course, the situation, as we discussed earlier on, the situation in Australia is quite different from what's happening in other parts of the world. But nevertheless, children have undoubtedly been impacted and still are impacted by COVID-19 in many, many ways. Can you perhaps, maybe you can start and then maybe Shandell can contribute. What are your findings? How much more important is health and well-being for children in this in these days, really, whereby we still don't know how far we're going to go, how far we are, what kind of expectations are there for the future. So there's a whole lot of things being rediscussed. I wonder how children's resilience is right now in our society. And maybe, Mitra, later on you can also give us your perspective from Geneva or from Europe in a sense. So Rosie, do you want to start maybe giving us some input?
Thanks, Manuela. Yes, I think with Health Lit for Kids, we acknowledge that with health literacy, there's really three elements. So there's the individual. So in this situation, we're talking about the children, and we seek to support the development of the health literacy assets of those children. And then around them is their social network or their community. So that would include their parents, their teachers, their school friends. And we hope that we can develop the distributive health literacy, the health literacy of the people around them to help them. And then in addition to that, normally we think about health literacy responsiveness of a hospital or a health service, but we've encouraged our schools to think about how they are health literacy responsive organisations. So when we entered each of our schools, so we've worked with 5 schools in Tasmania now, and we've got about 25 schools waiting for us to get the next lot of funding or an opportunity to work with them. What we found was the schools were really great at implementing an action plan if we did professional development with them. And I think I wanted to sort of explain these elements before I moved into some of the examples of things that we're seeing at the other end and some of the great outcomes that we're seeing, because it's important to highlight that the program focuses in the classroom at curriculum level, but it's also a whole of school approach. And so it's really important that we take those 3 elements, the individual, the community, and also the whole school environment, and look at that holistically so that then we can address equity, the social equity. Health literacy is the silver bullet, I believe, to address children's educational attainment issues that we have a lot of problems with here in Tasmania. Also the health outcomes of those children, both now, so as a child now with making health decisions, and into the future. And then obviously then the social equity, and so the question around their productivity into the future, because as we know, it's like a vicious cycle. So if we're not making great health choices, we're not being able to sit and learn, we're not going to be flourishing, productive individuals into the future. And so to me, it's a social justice issue that we address, and we make sure that health literacy is available to all children in the classroom and in education, and particularly earlier in their life course, because we want to prevent problems further down the line. So when we went to our teachers in our schools, the school curriculum is laid out for all school teachers in Australia, and they do name up health literacy in our Australian curriculum. And they have some specific areas they like our children to focus on, so mental health, food and nutrition, physical activity, safety, relationships, sexuality. There's lots of different topic areas that they ask that the teachers cover off on. And a lot of our teachers describe to us not feeling particularly confident to cover these things. So the professional development was an important element of that. Mm-hmm. And also doing it as a whole of school gave the teachers confidence. That was some of the outcomes that we saw. The teachers described to us this amazing student engagement, and I'll get to why the student engagement was amazing in a moment. Parental engagement was amazing. And the other thing that was this whole school approach came out as a major theme in our qualitative analysis. When we asked the parent perception, so we'd had the teachers' perspectives, we asked the parents' perspectives as well, and they said, I've seen changes in my children's behaviour, and we've seen a massive their children were fully engaged in their learning. They absolutely loved Health Lit for Kids. And one of the quotes that our children gave us was, yeah, it didn't really seem like real schoolwork. And I think the key was that we invited the teachers to pick with the children, so there was input from the children, a specific area of the Australian curriculum that they'd focus on, and then they would take a whole term to work on that health area, developing up all the assets they needed along the way. And then the final piece was an artefact. And so on our website, I'll get Gareth to share our website later, but there are these beautiful artefacts that these children have made, and they are age-appropriate voice for these children. So rather than us, trying to force a child to, tell us, or do a survey or a quiz on how health literate they are, we provided them with an opportunity to share examples or evidence of their development and their learning. And so that's something we're really focused on, the development of the children's assets rather than the measuring of it. And I think that's an important point of our research.
I think so. That's fantastic. What a great, really what a great program. And Shandell, do you think that by doing or putting this program in place, that certain anxieties related to what's happening in the world, which I'm sure children are also very much part of, perhaps help them looking at a brighter future, a different future, but to adapt to that future in probably in a faster way, in a less traumatic way?
Certainly, and the children were really being able to, as I say, create those messages. So when Rosie's talking about the artefacts, they're really those messages that the children were creating. And interestingly, in the schools that we've worked with, mental health and wellbeing has been a particular area of focus. So there are quite a few lovely artefacts that the children have developed, and they will continue to support their resilience and growth in those areas. So a couple of examples that come to mind were a really lovely project. There's a lot of activities around mindfulness for children, and as adults we know that's a great skill to learn, but how fantastic to learn that as a child. It's really great. And so one of the activities to come out of that was what's called a carton of calm. So it was literally a cardboard egg carton that the children decorated in their own way to make it their own. And inside the egg carton, they had little pieces of paper, like little scrolls, and each of those were written on them things that would help to keep them calm. So it's their own resource that they had, that they created, of ideas to help keep them calm. It's just beautiful. So those kinds of things have, and mindfulness is a skill for a lifetime. Being able to be resourceful in coming up with your own ideas about how you can be calm is also a skill that will last you a lifetime and create that resilience through difficult times.
That's absolutely. And I learned, or I read somewhere, actually I think I saw this short documentary about mindfulness meditation of children in schools in Thailand, but also in schools here in Australia, how that is something that some years ago would have been really off the curriculum, well and truly, and now it is part of course, part of fostering resilience in our children. And certainly Mitra can tell us so much more, because in Geneva, and I know you are associated with the Swiss Alternative Medicine Society, but also you're a certified practitioner with WHIS Kids. Meditation and mindfulness, that's part of it, right? Part of the program.
Yes, it is. Yes, it is. Actually, a simple explanation for children, so for what is health literacy, is simply how children can understand the information about health and healthcare, and how they can use it and apply it in their lives. You see how important in this COVID situation to educate children and people how to avoid getting and spreading this infection, and how to be an active partner to control this infection. Health literacy, weak health literacy, is associated with poor health, risky behavior, and more hospitalization, then more cost. Rather, the strong health literacy associated with developing skills and confidence, so that we take a better action in health, better health action. This is that through mindfulness, information, access to health literacy is the key needed for each individual and children, to be for their health and well-being, for having access to all this information. So this is great. You have a great experience here for children.
Right, that's wonderful. Well, we can just imagine what the new generation is going to be, what type of adults these children are going to be. Really, we're looking at such a transformation in society, hopefully for the better. And I am an optimist. So I believe it will be for the better. This is just a phase of a long discussion, obviously.
We all hope.
Yeah, exactly.
We all hope and we'll take our parts to it.
That's right. And in a society, in a country like Australia, which is so wide and is so big, it is not uncommon to have families living in different states or different cities, let alone different states. And it has come to our attention, of course, of tensions or issues, children missing seeing their grandparents, for example, grandparents missing their children, the connections with friends, the connections with families, which were not able to be carried out for some months, actually. How, in your experience, Rosie, been involved in programs in schools, etc., what do you think? Is this perhaps one of the major issues that has impacted children, or was more stresses within the family, lack of work, or mom and dad being at home all the time, not being able to go out and play? I know Tasmania had some restrictions in movement some months ago, and now, of course, those have been lifted, but certainly was a disruption in what children, their routine. How that do you think had impacted the children there?
Yeah, I haven't done any specific research on this, so I'm going to be honest. But, anecdotally, I'd say certainly amongst my friends and family, everyone has had such a different experience. And I think this highlights how health and having health literacy assets during something like COVID, and having people around us that can be, supporting us if we don't have adequate health literacy assets, that, they offer us that distributive health literacy, is so important. And so, some families coped fine. Like our family, we're very privileged. We're educated. My husband was able to, he's a pharmacist, so he was able to go to a team A, B scenario in his workplace, which meant he was at home more with my children. So my children were having, a parent facilitate their learning every day while I continued to work full time, and he did all of the teaching for them. But I know that, there's a lot of children who are in much more vulnerable positions. And, colleagues of mine in Department of Communities said, whilst the schools are closed, we're concerned for these children's welfare, because the schools are like our eyes on some of these children who are particularly vulnerable. And so I felt when COVID hit, that was the biggest thing that upset me and worried me. I lost sleep at night thinking, what about all these children, and what about all these families who are less fortunate, and how is this going to drive that inequity issue? And I think, we're seeing the financial effects, and I think some of those kids that really didn't go forward in that time, they didn't have the opportunity to learn, and so to me it sort of was a striking, like a real concern for me. And I still think there's a lot of work that we could do to address this inequity and make sure that kids that don't have that backup at home have as much of an opportunity as our children, those that are privileged.
Absolutely, yes. And of course, Shandell, please correct me. I believe you live in Melbourne. Are you? Yes, that's right. So Melbourne, for those of you who may not know, and I'm talking about our audience, Melbourne is a city in Australia who has suffered perhaps the worst situation of COVID, with ongoing lockdowns and restrictions on the second wave, and now luckily a recent lifting slightly in some parts of Victoria, in some parts of the state, some restrictions are lifting. So the children of Melbourne, the children of Victoria, of the state of Victoria, have suffered perhaps the most compared to other children in other cohorts in other cities. Is there any? Are schools equipped to, as the children go back to school to a certain normal, are they equipped to engage with them, to support them, not just in terms of curriculum or catching up with lessons and doing homework, but more in regards to really assess them and support them for what they actually understand or know, what COVID is, what the health literacy level is, how can actually, how they're feeling, what they're thinking, what kind of, do you know, what type of, I don't know, programs have been put in place?
No, I can't really comment on the particular school scenarios, but what this conversation is highlighting is, while we can be concerned about the individual knowledge of the children, it also highlights the way that health literacy is really a social practice as well, particularly for children. It's not common that children get to make choices about health all by themselves. You know, that they do have some control over some actions, but, you know, they certainly don't pop off to the supermarket and buy all the food, for example, you know, so they're what they have decisions over is in some ways limited, but they certainly have a big influence on the household. So thinking about health literacy as a social practice and thinking about how that works in a community setting, and particularly, as Rosie said, you know, we've all been caught up in this storm, but we're not all in the same boat. There are many different boats, and what's really important is, as you said, Manuela, is about understanding what children know and understand, but also understanding community diversity as well. So there's, you know, Mitra gave us an example of how we might explain health literacy, but there are a range of diversity of, you know, when we think about health literacy as a multi-dimensional concept, then there's a range of health literacy strengths, needs and preferences that we each have. So how do they play out for our children? You know, do they prefer to read something? Do they prefer to have something, see something in a little movie, or or do they prefer to hear it said to them? You know, who do they take with them to receive information? So when, you know, they have to go to the doctor or something, they have a parent or a trusted friend with them to help receive that information. So again, those kind of social practices, but also about responding to diversity. And I think that's what we're seeing now. It's very difficult for public health systems to be responsive in the same time as they're being reactive. So this pandemic has the learnings that come thick and fast during a pandemic, and it's really hard to put the learnings into action when you're still reacting to what's happening. So I think now we're moving into that stage of recovery, and in that stage of recovery, it really helps us to think, how do we now protect the most vulnerable? And some of those are our children. So how do we look after our most vulnerable communities now, and to perhaps be a little bit more protective, preventative, you know, move back to that space rather than reacting. So it really is about that recovery now.
Mm-hmm. Sure, of course. Yes, absolutely. And Mitra, can you tell me, you are once again a certified WHIS kids professional. Is this program available in a number of schools, in a number of settings in Switzerland? How does it work practically? If a school or an organization was interested in your program, what would this organization need to do, and how does it work practically?
Actually, we are trying to just expand this program at schools. So we are working on it, but in parallel, so we are giving these courses private through SAM as an activity that SAM just apply it. Because, you know, but you're not waiting for that the schools just getting all the schools getting because all these WHIS Talks and information helps, you know, to get into that, all this information. But beside that, you know, we do our best to knowing this program, because it's health of the children, you know, it's actually health literacy. In old days, it was depends of the health literacy of their family, but we are trying to give these tools in the hands of the children by this education, because you know, if a family, you know, there's always a gap in children's life, even if they grow up in a family with high social level, with high education, you know, but sometimes, you know, the health literacy in families is not going simply smoothly to the children, you know. So this is now and when that all the schools and academic program should be provided for the children separately of the level of the health literacy of the families. And this is what World Health Innovation Summit just doing it through WHIS Kids program. And this is the innovative part of it, with its interactivity, high interactivity of children. The children, they see their issues and they find the solution by themselves, because through WHIS Kids, we give the ownership of the tools through mindfulness, through giving the education, the knowledge of sustainability, and through yoga type exercises. Through all these, they see their similarities and the difficulties they all share. They see their weak and power points in order to be able to take the decisions and having confidence on their decisions, to be able to navigate their lives, you know, and be more confident of the decisions, and to find the best setting for themselves, because it's a person-centered program, alternative program. It's a workshop for children, and it's a personal, developing a person in health literacy, and in-person psychological part of, and physical and psychological part of knowing himself.
Yeah. And I know it is also very popular. So congratulations to you and so many others who are part of the WHIS Kids in Switzerland and in Europe, really. I understand it's got quite a lot of interest in Greece and other countries. So that's great. That's wonderful. That's a great growth, and certainly much needed.
The health workshop.
Yes. And I was wondering,
it's a health workshop for children, health well-being.
Right. Okay, thank you. And Rosie and then Shandell, of course, this is, look, I looked at your program. It's fantastic. And I didn't know, I wasn't aware of the program in itself until, of course, my interest went in, and I realized that it has been covered through the media, but I think there should be so much more. We should have put it in big letters around Australia, because it's so much needed. What's your project for the future? What's your plan, Rosie?
Yeah, so I've just been fortunate to be awarded a Winston Churchill Fellowship. So that allows me to travel overseas. So I hope to meet with experts, health literacy experts in Germany. So we've got, Shandell and I've got friends scattered in Europe actually, and Mitra, I'll have to come and visit you while I'm in Geneva. So part of my trip, when we can travel, will be to Geneva to the World Health Organization. So that's where I'm finishing my trip, which will be an 8-week trip. And we'll be going to Finland, to Germany, the UK, and also to Denmark, and then finishing in Geneva. So we want to find out, where does health literacy lurk? Where does it live in these countries? How are they doing health literacy? Is it in community? Is it in education, or is it in health, or is it across all three? And so the answers to those questions will help us, I think, to really pin down how we can make health lit for kids and health literacy really valued in school settings. I think that Europe's going to have some of the answers for us. While some of our colleagues, particularly in Germany, are excited about the work we're doing here, we're very excited to learn with and from them as well. So, yeah, it would be great to meet when we come. The other thing I want to highlight is that the World Health Organization, in one of their 2020 reports, highlighted to us that health literacy will be key to us achieving our Sustainable Development Goals. And so that's how I want to finish this, my statement, and say, like, we need to be addressing health literacy, and we need to be providing our future generations with the asset of health literacy, and that should be through your classroom so that we get to all children, not just some. Yeah.
Oh, look, terrific. And I think it's absolutely correct to also add that there are different school of thoughts. There are different groups, if you like, in the world, experts in health literacy, and they all have perhaps a slightly different take on what health literacy is about. But I think that, I reckon that it would be fantastic just to meet up in Geneva, that's for sure, and perhaps, yes, and in Europe, absolutely. I think that's probably the group more aligned in terms of visions with your work. So I'm sure you'll be very well received. Shandell, are you also going to this event? Are you?
No, I'd like to be going.
Yes.
I'd like to be going with Rosie and carrying her suitcase. We've travelled before together, and Rosie's suitcase is always much smaller than mine, so I know it wouldn't be a burden. But no, I'm very supportive of Rosie and looking forward to her journey. I think you raise an interesting point around the differences around how health literacy is conceived, and I think people like to singularly define health literacy is almost like seeking the Holy Grail in a way. It's more about the ideas and the concepts and that sit behind it and what it means to the communities in which we're working. So I think having a really broad perspective and open understanding is a really good way to approach it. Really excited about the way that the World Health Organization and the Sustainable Development Goals support all of our work in this area, and particularly for children and for non-communicable diseases. And as we've talked about this evening, this morning, about the importance of working early on in people's life course to achieve long-term change. It really does make a difference.
Mm-hmm, absolutely. So I would like to conclude that good luck to all of you. You all doing a tremendous work. I am absolutely proud. I am a fan, absolutely adore health literacy. I think it should be front and center of the WHO. Absolutely. Without that, we're not going to go anywhere, really. And it's great that we start with the children. So thank you so much for your time. Really, I really appreciate it. It's quite late here in Australia. Thank you so much, Mitra, for giving us your insight in Geneva. And you never know, you and Rosie might meet up sometime soon. So thank you so much and have a good evening.